When Patsy Stinchfield was a young nurse practitioner 3 decades ago, her hometown in the U.S. Midwest was hit by a measles epidemic. She remembers seeing sick children, fearful families and tragic fatalities on the wards of her own hospital. Watching those children die in a rich nation from an epidemic that was easily preventable changed the course of her career. Today she runs infection prevention services at a major children's hospital and serves on government advisory boards. Yet once again she has found herself fighting a measles outbreak in her home state of Minnesota. Once again, she has seen panic on faces of parents as they admit sons and daughters with a disease that can kill, damage or disable. And once again, she knows this would not be happening if young children were being given a cheap and simple vaccination. Yet she is not only fighting a deadly disease. She is also up against a disgraced British doctor who has been declared public health enemy #1 in the US for spreading damaging and widely debunked theories. Andrew Wakefield is a former London specialist sacked on ethical grounds after linking the measles, mumps and rubella, MMR, vaccine to autism. Now he leads a lucrative movement campaigning against childhood inoculations. These jabs have led to huge improvements in health and life expectancy around the world, yet Wakefield's fanatical followers accuse governments, doctors, drug firms and scientists of colluding in a giant global conspiracy to cover up risks. And they are growing in strength, their bogus claims inflamed by the US president who backs their anti-establishment stance and has personally endorsed the reviled ex-doctor. Wakefield was even at Donald Trump's inauguration ball earlier this year. Yet if immunization levels drop below critical levels, dangers of these highly contagious diseases grow, as seen in several countries across Europe, where there have been 35 deaths from measles over the past year. Last week the World Health Organization revealed that measles has been eliminated in Britain. This is a major advance. In 1967, before the vaccine arrived, there were 460,000 cases and 99 deaths. But the US outbreak is a warning about the frailty of such success, for the illness was declared eliminated there in 2000 and across all the Americas last year. Minnesota shows the dangers posed by the anti-vaccination movement, especially since critics suggest Wakefield played a part by holding secret meetings there. I know measles takes lives because I have seen it, says Stinchfield, Senior Director of Infection Control at Children's Minnesota Hospital. This outbreak emerged in early April among a Somali American community that arrived in the state after civil war erupted in their own nation at start of the 1990s. Measles used to be the biggest killer of children aged under 5 in Africa, and with 10,000 deaths a year in Somalia, the migrants knew all too well the dangers of the disease. So by turn of the century the community in Minnesota had the highest vaccination rates in the state. But over the subsequent decade, immunization rates suddenly began to slide, from 92% of this population in 2004 to just 42% by 2014. Clinicians would call me and ask what was going on, recalls Stinchfield. Why are they not having MMR when they are getting all their other vaccines? The reason soon emerged: fear of autism, a condition that does not have a specific name in the Somali language. I had never even heard of it although I come from a medical family, says Anab Galaid, a Somali American health researcher. The number of children being diagnosed on the autistic spectrum is rising rapidly in the West, and the condition often becomes evident around the age that they have their first MMR injection. The 25,000-strong Somali community feared it was being struck by a Western affliction. We did not know of autism before, says Miriam, a mother of 4. Many families stopped giving their children MMR. They had stumbled upon Wakefield's discredited claims, which were being fueled online by alarmed parents of autistic children, alternative practitioners and conspiracy theorists. They were mentioning him by name, says Stinchfield. They were even saying their parents back in Somalia were telling them not to have the triple MMR jab in the United States because your child will get autism. Wakefield was a gastroenterologist at the Royal Free Hospital in Hampstead, North London, when he raised concerns in 1998 over the safety of the MMR vaccine, based on his report, looking at just 12 cases, in the medical journal The Lancet. The report, suggesting a link through a bowel disorder with autism, was later retracted as utterly false by the journal. The General Medical Council revoked Wakefield's medical license in 2010, ruling his conduct dishonest and irresponsible. And the British Medical Journal concluded his work was fraudulent with data manipulated. But Wakefield Ha.